Assalamualaikum, a very good evening, ladies and gentlemen. Welcome to yet another episode of Perceptive Learning Zone. And today we are going to be discussing the concept of diagnostic artificial intelligence and its application in the field of medicine in the contemporary society. Now, according to OECD estimates, 20% of healthcare spend is being wasted globally. The United States Institute of Medicine, it believes the figure is more like 30%. And if you were to utilize both the estimates, the top 15 countries by healthcare expenditure, they waste an average of between 1,100 and 1,700 US dollars per person on an annual basis. Now, to put this into context, the average waste per person across the top 15 countries, that is 10 to 15 times more than the average amount spent by the bottom 50 countries on healthcare, who currently spend an average of around 120 US dollars per person. Even more concerning is the fact that the underlying reasons for this waste, they include preventable and rectifiable system inefficiencies, such as care delivery failures, overtreatment, as well as improper care delivery. Now, technologies such as artificial intelligence, they can help minimize such inefficiencies, ensuring substantially more streamlined and cost-effective health ecosystems. Now, there has been much debate in the past decade around the potential implications of AI-driven technologies in a number of industries, including healthcare. I mean, that's obviously provided that you weren't blown away by Google's recent lifelike AI assistant, then you're most likely a time traveler from the future. Now, while we are not yet at the stage of autonomous robots doing our house chores and driving us to work, the traditional, which is obviously the traditional perception of artificial intelligence, ladies and gentlemen, there is substantially strong evidence that is pointing to a number of ways in which AI can help tame the healthcare costs. So, how? First of all, we talk about guiding treatment choice. So, in today's world, being able to effectively and accurately harness the power of data, it enables more efficient decision making across most industries. Healthcare is no different. So, what do I mean? So, as healthcare providers, they gravitate towards a standardized format for recording patient outcomes. Large sets of data will become available for analysis by AI-enabled systems, which can track outcome patterns following treatment and identify optimal benevolent strategies that are based on the patient's profiles. Now, in doing so, artificial intelligence, it empowers critical decision making and ensures the right interventions and treatments are being customized to each patient. And this creates what we feel a personalized approach towards care. The immediate consequence of this, it will be a significant improvement in outcomes, which will eliminate costs that are associated with post-treatment complications. And this is one of the key drivers of cost in most healthcare systems across the world. Another landmark achievement of diagnostic AI would be more efficient diagnosis. You see, fellows, repetitive and uncomplicated tasks such as the analysis of CT scans and certain tasks, they can be performed much more accurately by AI-enabled systems. So this will significantly mitigate or reduce physician error and enable early diagnosis and interventions before conditions become critical. As an example, an Israeli startup has developed AI algorithms that are equally or more accurate than humans when it comes to early detection of conditions, such as, for example, to name a few, coronary aneurysms, brain bleeds, as well as malignant tissue in breast mammography and osteoporosis. Now, according to a recent article in Wired I was checking out, AI has demonstrated 99% accuracy and is 30 times faster in reviewing and translating mammograms, hence enabling much earlier detection of breast cancer than humans are capable of. In cases such as osteoporosis, which costs the UK's National Health Service approximately £1.5 billion annually, and that obviously is excluding the high cost of social care. The detection of vertebral fractures. The detection of vertebral fractures, an early indicator of impending osteoporosis, which is commonly missed by human diagnosis. This can substantially reduce the cost of this condition to health services. Another achievement of diagnostic AI is the optimization of clinical trials as well as drug development. AI has the potential to enable faster development of life-saving drugs. It saves billions in costs that can be transferred instead to health ecosystems. More recently, to illustrate the school of thought, a startup that was supported and endorsed by the University of Toronto, well, it programmed a supercomputer, ladies and gentlemen. It programmed a supercomputer with an algorithm that simulates and analyzes millions of potential medicines to predict their effectiveness against Ebola. Hence, in the process, it saves costly physical tests and, most importantly, lives by repurposing existing drugs. In clinical trials, AI can optimize drug development using biomarker monitoring platforms. Biomarkers, they allow for gene level identification of diseases and millions of patient data points, which can be analyzed in seconds from a drop of blood using at-home devices. Also, we talk about empowering the patient. So now AI, artificial intelligence, fellas, it has the potential to truly empower us as individuals who, as individuals to make better decisions regarding our health. So vast numbers of people across the world, they already use wearable technology in order to collect everyday information from their sleep patterns to their heart rate. And that's quite amazing, isn't it? Applying machine learning to this data, it could inform people at risk of certain diseases long before that risk becomes critical. Mobile apps are already providing granular level patient profile information that could help people living with specific chronic conditions to better manage their diseases and live healthier lives. So, all of this can lead to healthier populations as well as a significant reduction of the overall cost burden. So, corollary, what do we conclude from all of this? That these examples, these illustrations, they represent a small, minute fraction, fellas, of what is possible when the full potential of artificial intelligence is leveraged in the delivery of healthcare. The possibilities now, at the moment, as we stand in the current status quo, the possibilities can neither be underestimated nor can they be overemphasized. And cooperation between public as well as private sector industry stakeholders is vital if this potential is to be realized. So, as global populations live longer and the prevalence of chronic disease increases, the rising cost of healthcare will continue to remain an important topic amongst the healthcare stakeholders. So, in conclusion, perhaps it really is time to call in the machines to this sector. Well, that'll be all for now, fellows. Please stay tuned for other episodes of Perceptive Learning Zone. Please make sure to like, share, and subscribe. Meet back in y'all once again. And we'll be back soon with more enthralling content. You all have a lovely evening. God bless you all. Assalamu alaikum.